The West Midlands Cancer Alliance is responsible for system leadership across the whole pathways of care. These delivery plans set out how system leadership across both programmes, including strengthening and building relationships with sustainability and transformation partnerships. Whole systems approach is taken to service reconfiguration and is delivering results aligned to the national strategy achieving world-class cancer outcomes. In Warwickshire STP Cancer Subgroup are one example of how STPs are working across the pathway of care with primary care, acute trusts, local authority, public health and other stakeholders. These representatives have a unified aim to drive improvements in cancer care.
This is a group of like-minded primary care clinicians, public health representation, CCG representatives from the various CCGs within Coventry and Warwickshire, and Macmillan and Cancer Research UK. The Primary Care Network has taken lead on various initiatives. One was related to bowel cancer, where we have become the first area in the country to have GP endorsement of bowel screening letters. With this minimal sort of change in the bowel screening letter, the uptake in bowel screening is increased by approximately 6%. The network has also set up various educational events. There have been events related to bowel cancer and lung cancer for primary care and pharmacists. One of the highlights of the event was a presentation by Dr. Vicky Drought, which included the top 10 tips for improvement of early diagnosis of lung cancer. Such practical suggestions as the time when to repeat a chest x-ray if it's been reported as abnormal, or the significance of a nodule seen on a lung CT. And this sort of network can be reproduced in other areas and be as effective in helping to improve early diagnosis of cancer.
Together, we have developed and delivered structured cancer screening training for clinical and non-clinical staff. And we have secured additional resources to deliver interventions to bowel screening non-responders. We have got posts to deliver the Living With and Beyond Cancer programme, and we have a primary care facilitator post. We've also been able to foster good relationships with others, such as academic colleagues at Warwick Medical School. The key to our success has been the strength of our relationships. We share ideas, we understand each other's opportunities and limitations.
My name is Hazel Blanchard, and with my close colleague Kate Day, we work across Coventry and Warwickshire. We both work along all parts of the cancer journey, from early diagnosis through to work streams looking at end-of-life care. We as a whole team agree that education across this whole spectrum of primary care is a really important thing to do. And along with some support from Macmillan, we provided some training for pharmacists about what the pharmacy role for patients during their cancer journey might be. To offer some training to medical students to help them better understand what it is like for patients to live with and beyond cancer. We've also done some training with our specialist palliative care colleagues for GP trainees, the ST1s. We also developed some work alongside practices nominating a cancer champion or a clinical cancer lead within practices. Alongside our CR UK and screening colleagues, we also undertook some training for non-clinical cancer champions within primary care. As a group, we see that training of the whole primary care team is really essential as we look to a future of overstretched, under-resourced population of GPs.